Definitely, the implication is that members of our communities in Mubende and surrounding areas will miss the opportunity of interacting with their members of parliament for some time. But I think it's for the good. First of all, Ebola is very, very contagious and it's very dangerous and it spreads very fast. So we need to put health first. You cannot say right now that you're more interested in your member of parliament coming to the community, which may be a danger to the member of parliament, but also members of community. Because when the members of parliament go to the community, that means that members of the community will gather and then there will be a risk of the spread of Ebola. I think it's really for the good. I think we need to be very mindful of our health, the health of the members of parliament, but also, most importantly, the health of members of the public. And I think it's a welcome idea. I don't have a problem with it. And I think it is advisable, not only for the members of parliament to not go to the communities, but also to members of the community. I had already spoken to some members in the public. The people who stay in Mubende, Mityana, Kasanda, Chiboga, Mpigi, Gomba, Mubende and surrounding areas, because they are more at risk. If there are movements between those districts, then the spread of Ebola will be really high. And I think we need to work together to contain that spread of Ebola. Certainly, it's not just about my constituency, it's not about Mubende, it's not about Mityana, it's not about, but all parts of the country, we still have a challenge when it comes to health. And this was evidenced when we got the COVID pandemic. Everyone got to understand the health state of this country. So I cannot say that we are very good, but we would like to appeal to government to do something to improve the situation so that these patients can be well taken care of, and then there's no spread of that Ebola, because Ebola is very dangerous. And Uganda is well aware of this because we've dealt with the pandemic in the previous years.
Very bad indeed that the world is going through an economic meltdown where Uganda is not exceptional. Businesses have just been coming up. Now at this point in time, we are having Ebola, which is also very, 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 very deadly. As members of parliament, we are supposed to create awareness to our people. We are supposed to be with our people through thick and thin. We are supposed to motivate them to seek medical attention. But now under circumstances when we are not with them, medical practitioners should be readily available to provide technical backstopping to help our people. At this point in time, Ministry of Health should be ready to have all facilities, all requirements in place, and also to motivate our people to seek medical attention from the health facilities around the area. And people should be properly motivated because, you know, our people have been sacked up to the bone marrow by these unscrupulous medical practitioners, where people are demanded to pay for each and every service in the hospitals. Now, if it continues like that, it's going to be a problem because our people will fear going to the health facilities, and then the problem will be hyped. So at this point in time, we call upon the ministry to do everything possible that motivates people to seek medical attention from health facilities. That the message should be thorough and proper. People should know all the signs. People should know what they are supposed to do. Secondly, we should also think about decongesting some of those overcongested places, overcrowded places, like in the gold mines in Madudu, where we hear that the people operating those mines are very big and untouchables. It is going to be hard for the technical people to provide technical backstopping to help our people. So it is very important that clouded areas are decongested at this point in time.
It's extremely difficult and unfortunate that we have the outbreak of Ebola within our precincts, within our districts, Mubende, which is our neighboring district of Kasanda, and I have a number of people that are very close to Mubende district. It's disheartening that most of our people are succumbing to Ebola. We are hopeful that the Ministry of Health will be able to prevent the rapid spread of Ebola into the neighboring districts. But most importantly, we hope that the Ministry of Health will be able to create more awareness and sensitization for people to know what they should look out for, to know what they should do in order not to continue the spread of Ebola. We also hope that the teams will be more vigilant, the teams on ground, the teams of the medical workers, the teams from the Ministry of Health and the local teams, to be able to sensitize people, but also to respond faster to people who have shown signs of Ebola. Now, as members of parliament of the neighboring districts of Mubende, we are unable to go into the communities, deeper into communities, because right now we don't know how far it has spread. Definitely we will continue spreading. It will affect our work, definitely, because we have a number of community engagements we have planned and we have lined up for our people. But I think it's for the good of everyone that we desist from spreading or interacting with more people, because at the moment we are not yet sure of where the spread is and the numbers. We'll continue voicing the concerns of our people in Parliament and in our committees and in various media spaces that we will occupy to ensure that everyone gets the right message, but most importantly, everyone remains alive and well.
Honorable Speaker guided so well. We would have loved to be with our people as of now, because, you know, even when someone loses a person, even if you're a neighbor, you need to be there to console them and condole with them. But right now, the epidemic that we're talking about is very contagious. Ebola is a very contagious disease that needs to be contained by people who are specialized, the professionals, and people who are actually designated to be in that field. Yesterday, I talked to one of the commissioners from Ministry of Health who is in charge of disease prevention and health promotion. He told me they are sending a very able rapid response team to go in the district and try to curb the situation. And as I talk now, a lot of activities are moving around, and so they are trying as much as possible to contain the disease. Right now, as politicians, we would have loved to be with our people, because some of us are professionals, but by law, we are not allowed to do that. In case of anything, ministry will not protect me, government will not protect me, but those people who are designated, who are appointed to work as such, are protected in case of anything. So we want to urge our people to be very careful with this disease, because Ebola is very deadly. It is a disease that can easily be contained, but it is a very deadly disease. So our people need to be very cautious. They have to wash their hands. They have to keep distance. Actually, people should restrict their movements, even in their homes. Right now, Right Honourable Speaker has mentioned that for us, as members of Parliament, and even other political leaders at different levels, need not to go into the communities, because when we go to our communities, our people love us. And so they will gather and make big groups, which can be very dangerous in terms of transmitting the disease. So we want our people. Now that you are being in Kampala, how are you going to face it? Thank you. If you see that my people are protected right now, I've been talking to the surveillance officer in my district to see what actually is happening, and he told me he was writing a report to see what the state is right now. So he told me very soon he'll be giving me the report, and so that report will also be sent to Ministry of Health for action. My role as I'm in Kampala right now, as a member of Parliament from Mubende District, is to ensure that all that is needed in Mubende District goes. That is, to push Ministry of Health and government to see that they respond to the needs of my people as far as containing the disease is concerned. Is the protective gear for the health workers who are going to go on the front line, because they have to be totally covered. Ebola is very contagious in that even when someone just gets in contact with an infected surface or person, they can easily contract the disease. So what we have to do right now is to ensure that they get all the protective gear that they require, and then the other consumables like gloves, sanitizers, soap, and the medications or the other supportive medications that they need to use on the patients while in the hospital. Like I told you, I've just spoken to the surveillance officer, and he mentioned that he's drafting a report because he's on ground and the Ministry of Health team. So we do not want to preempt what they are writing. Yes.